Um, I think, really quickly, and I'll see it. Present. Okay. These, I will start with Dr. Friedman. Um, Thank you for being here, Dr. Friedman. I'm sure you're a very busy person. Um, I spoke to Michelle today and kind of broke it down a little bit so that
hmm
you would know what we were going for. Can you, uh, first of all, the members, Dr. Friedman is from Mental Health here in the building. And I asked her to come because of the teen violence that is so prevalent in our community and everywhere else in the city. Um, Years ago, I had told Michelle that when it was Riverdale Mental Health,
hmm
they had workers going into the schools, the middle
Yes,
schools, and speaking to the children. And I think that kind of helped. Do you do that kind of thing now?
sure. I will I'll give you guys a rundown on what I do, and I do have a PowerPoint if I may share that with you all as well.
Sure.
So maybe I'll introduce myself and tell you a little bit more about what we do and what we've been doing. I'm Donna Dimitri Friedman.
Sure.
I am the executive director of Mosaic Mental Health, which was formerly Riverdale Mental Health. We have been serving the community of Riverdale, Kingsbridge, Marble Hill, Spuyten Duyvil, and beyond for since 1959. And I have been the executive director since 2017, but I've been at the organization for 33 years. And some of you may have known my predecessors, Joyce Pilsner, who I think was the Community Board 8 president at one point, very involved
Yes.
in the community board, and Robert Brewster, who was my predecessor. Um, Over the years, we've done a tremendous amount of work in the schools. Prior to the pandemic, we actually had clinicians in JFK and 141, and I did some consulting in the nursery schools. And unfortunately, for a variety of reasons, not the least of which was that people were working remotely, a lot of those opportunities that we had to directly work with the schools turned into a very challenging situation because we literally couldn't find clinicians who were willing to go back into the schools and do that. I
Uh,
do know, however, that we have continued to provide services and have fast track programming so that when kids are referred from the schools, we are able to, work with them very quickly. But one of the things that I wanted to share with you is last month I was at the community board presenting the fact that we have purchased 521 West 239th Street, which is the building that used to be the Beatman Center run by the Jewish
well,
Board of Children and
yeah.
Family Services. And during the pandemic, they closed shop. We did not, but they did, and they never came back to provide those services. They put the building up for sale. And Assemblyman Jeffrey Dinowitz contacted me and said, "Boy, that would be a beautiful location, a perfect location for you all. And I have been working for the last 6 years trying to integrate for the community a partnership with one of the federally qualified healthcare centers called Union Community Health Center that serves folks in other parts of the Bronx. And they are going to ultimately occupy part of the building as well with us as a co-located full service healthcare and mental health and substance use disorder provider. And we will have OT and PT, primary care, substance abuse, and certainly lots of mental health services for children and adolescents and adults. We're very excited about this. We're actually moving out of 5676 after being there for over 50 years. I believe it's been, and I've been there for 33 of them. That building that you're in has been my second home. And we're excited to move because I think that we are going to be able to serve more and more people in the community because people are going to come for a variety of different services, and that will include folks who want to come for any of the other services, including dental. We lost about a third of our clients when we had to go remote during the pandemic, and we've been actively pursuing and trying to re-engage people and bring them back. But the biggest hit has been on children. I think that very sadly, the community and throughout New York City, we have suffered a great deal post this pandemic. And certainly the state of affairs nationally has not helped one iota. And the gun laws, of course. All that said, these are things that we don't currently have any control over. One of the things we do have control over is getting back into the community, providing services in the way of, opportunities for teachers and parents to ask questions, how to ask your kids questions, how to figure out, ways that we can, as a community, create safe spaces for kids to hang out. And the idea that children would go to a McDonald's after school and be killed on the street is just about as horrifying as we can possibly imagine. And so we, as a community mental health center, very much want to, and this is one of the reasons why we are integrating with this healthcare group, is because I want to get back to something that we did a great deal of in the past, and I was one of the people who did it. Anytime there was an emergency in the community, we deployed our senior-most folks to go. There was a death at Riverdale Neighborhood House one year of a child. We were there immediately. There was a potential active shooter during a snowstorm at 141, and my deputy and I got in the car and went over there unasked just to be there to support the principal. So we are very interested and want to be of more help, but we are building it. And a lot of people don't want to acknowledge it, and I actually get criticized sometimes for bringing up the pandemic, but it's as if what was a global pandemic and had created a mental health worldwide crisis. There's been very little to no acknowledgement of that. So part of what we're seeing is that young children who were struggling at home during the pandemic, getting into, challenging situations at home. I think we're seeing now some of the fallout from that. And if you do the math, we're in year 6 of when the pandemic started. And so some of these young people were 9, 10, 11 years old in grade school, and now they're in middle school and high school. And a lot of stuff has not been dealt with, and we are aware of that. I will definitely find out who is in the schools right now, because I know that there was a big push to get some providers in the schools. We will do our very best to try to, at the very least, provide, opportunities for discussions with parents and also with the students. That said, I do have a presentation which kind of goes through some of the things I think we need to think about. But before I do that, I would love to hear from you about some of the questions that you might have for a mental health leader with regard to this specific situation and in general.
Well, if I may start the conversation, my feeling is that the 15 and 16-year-olds don't know how to communicate with their peers.
Yeah.
Because everything becomes violent immediately and they're all armed with guns or
Mhm.
knives or whatever it is that they have.
Yeah.
I think that something should be done in the schools where there is some kind of tutoring on how you build up relationships with
Right.
your peers.
Right.
Because my daughter, my oldest daughter, when she was at 141, had fights with everybody. She's that aggressive kind of person
Hmm.
uh, to this day. And at that time, they would meet after school,
Hmm.
unbeknownst to me, and they would have a fight. And the next day, they have it out of their system. They were friends again. It seems that now they hold the grudges. They
Hmm.
don't know how to relate to their peers, and they only think of violence to get out of the situation. This morning at 10 o'clock, I got onto the TV, and a 15-year-old was shot in the subway in Queens. Uh, there has to be a way to reach the children to let them know that violence is not the way to go.
Right.
Because
Right.
once you shoot them, unbeknownst to them, people don't get up from the ground and live their life. In the games that they play, that's what happens. But
Right.
in real life, if you're dead, you're dead.
Right.
And that the West 238th Street situation, I don't know why that was happening, but whatever it was, the child, 17-year-old, was killed. And two other students that were near him, they got shot, but they lived.
Right.
They're injured.
Right.
And it seems that that's the only way they think things are. I don't know if it's an influence from what they watch on TikTok or Instagram or whatever it is the media puts out. But parents have to, I think, I don't have any boys, so I'm talking about boys.
Girls. It's girls too.
You just said your daughter was a fighter.
Yeah, girls. Girls
What?
are at it too.
You just said it. You said boys, but you said your daughter was a fighter too. So it could be girls as well as
Girls.
boys.
Right, yes, they could be.
Equal gender
But
about our violence here.
you as a parent know what your
I
child
just watched a girls'
can
hockey
do.
game. They were ready to throw
and
down
and
sticks.
the
Let everybody be
the
violent.
young man
Sorry.
that threw the girl on the ground
Millennial over here.
and thumped on her head
Being woke.
and gave her a concussion. The mother said,
Sorry.
my child could never have done that. He's very quiet, he's respectful, and blah blah blah, and obviously it was on tape. Everybody saw it.
Right.
So she is delusional and thinks her child is perfect, but yet he's not.
Yeah.
That child needs help. So
I think
I don't know what end to start on.
Well, I think that this is how these things come to really come together, right? So I applaud all of you for asking me to join you tonight because I think we have to create a call to action to the community to involve and I know the perfect person to speak to about this. I will talk to the Dinowitzes, both of them, and we can think about how, as a community, we can create a series of conversations that I'm happy to be involved with and can get my staff involved with. And now that we have a new location, we can do it in person. We can also do it on Zoom. And I think we need to go school by school and offer these kinds of supports because one of the things that we have to acknowledge and recognize is that I think a lot of parents are feeling extremely overwhelmed by their own children because the children, some of them are, out there with their friends, and we all know that adolescence, by the time you're 13 or 14 years old, you are more likely to listen to your peer group than you are your parents, unfortunately. And this is a developmental thing. And the other piece I think that is critical is to get young people who aren't involved in this violence to be part of the solution as well. Because the more children, the more people, when we think back to our own lives and maybe think back to what we were doing in junior high school and high school, kids with idle time get themselves into trouble. And when you're on a team or you're in an activity, oftentimes there's a grown-up involved helping resolve these kinds of conflicts. And I think that too often there's a number of factors. You have, and you stated it well, TikTok, Instagram, gaming, right? These games are violent. And access to guns, of course. So you have, no problem solving skills. And also the other piece that I think is really critical is children, because they weren't in school and their families are very stretched to do it all. They haven't had social interactions to develop those skills. I mean, I worked with a lot of families who had grandma and grandpa, they were working from home. The kids were trying, they didn't have Wi-Fi. They were trying to hold down so much. And the less money you had and the less resources you had, the more challenging it was. So here they are now, these kids who are 17, were 11, 12, 13 years old, 14 years old, really not developing some of those social skills that happen in those middle school years, right? And then, of course, we have drugs and alcohol use. And so when you put that together, lots of kids are using marijuana and other kinds of drugs. So their judgment is off. So we have a lot of work to do as a community and as a city to really begin to address this. And it's not going to be an easy fix. When we have worked with young people and we do a lot of work with adolescents at the agency, the first thing we try to do is to engage their other supports, their family, their community, their friends. And that often we find that it's the time that these adolescents are fighting with their parents as well. So there isn't that ability to oversee and control what kids are doing. But it's a very sad, scary time. And we have a government that shows us that violence is acceptable. I mean, what's happening with ICE and the president and all of this has just exacerbated young people's idea that we're like in the Wild West right now and anything goes. So as adults, as the grown-ups in this community, we have to stand up and say, no, this isn't how we want our young people to be living and dying. But it's going to take a concerted effort. And if I may, can I share my screen? Let's see if I
Yes, I
can
made
do
your
this.
calls.
Let me see if I can put it up here. Um, oops, go here. Let's see if I can get that on there. Okay. So, can everyone see that?
Yeah.
Okay. So the impact of this is really profound, right? There's an emotional toll. I mean, every time we hear about something like this happening, there's shock, there's sadness, there's fear. I mean, as a parent of a young adult living in the city, it's terrifying to me to think of my daughter out in the world, in the subway, where she lives in Brooklyn. That fear exists, and we all are feeling it for our children. And the social impact is huge. There is this incredible sense of things are being disrupted. There's a lack of trust. And of course, the mental health struggles and trauma that ensues from this violence is long lasting. Those two young people who observed that, who were injured, they will never be the same, right? We know this. And we know that those parents and that family will never be the same. And so some of the immediate responses, I don't know what the immediate response was to that situation. I think maybe we can set up a mechanism in the future so that if the community board learns of something that we don't know, you can contact us and say, we need some help with this. Is there any way to deploy someone to provide some support, at the very least for this family? But very importantly, we need to create spaces in the schools and the community centers and faith-based hubs where there are safe spaces for young people to be together and to not be out on the street, where they can be in this situation where they will be harmed. And then we need to, as a collective, be communicating with the community about what is happening and how we are trying to address this. And maybe what we need to do, is get together a task force of maybe the principals of the schools and some folks from my organization, maybe someone from the community board, maybe some parents. To really come up with a plan, because what we're doing right now is maybe at best reacting when these things happen. And the only way we're going to correct this is with prevention and immediate intervention when it happens. There are a number of things that we can do to try to facilitate community healing. And things like memorials and visuals and things like that help in the immediate. But really, what needs to happen is we need to have more youth engagement through things like mentorship and sports and art and ways to bring young people into our spaces where we can give them alternatives to hanging out and fighting. And then restorative conversations to rebuild trust. I think before we have any restorative conversations, we need to teach them how to have conversations about conflict. So, I'm not sure if there's conflict resolution in the schools that it's taught. One of the things that I've always been disappointed in is that school teaches you certain academic things, but some of the more important basic life skills need to be embedded in the curriculum. And so that would be another way for us to get involved. What are the kinds of things that really need to be reinforced by parents, by community leaders, by the schools, and by after school activities that are available to kids? but, at the end of the day, we also have to address root causes. And gun safety and education is critical, but we know that young people have access to guns. It's very easy, apparently, for young people to get guns, and so that's another piece. I think we need to include our local precinct and really trying to understand, where are these young people getting guns? How do they know where to go to get a gun? And to really, and I will talk to whoever is willing and interested to hear. We need violence prevention programs in the schools, and it has to be a collective between the mental health side and also the leaders in the schools, coupled with parents who need to reinforce this at home. And so partnerships, as I said, with the Y, with the community center, with Riverdale Neighborhood House, we need to band together and come up with a way to help really address these young people specifically. And then the other piece, which we can certainly talk to our elected officials about, has to do with policy and advocacy. And that really is to advocate for stronger background checks, red flag laws. Like I said, I don't know where these young people are getting guns, but they're not old enough to buy them legally. But I'm sure that there, are other ways that they get guns. And I know that parents sometimes have guns and kids get access to them. So we need to tighten that up, and that's law enforcement. But we need to bring young people with us to be the voices also, because it's not all kids, and I'm sure that it's a terrifying time. I mean, I remember growing up in the 70s, the 60s and 70s, and people didn't have guns, but there was a lot of fighting, and young people. I mean, this is an age-old problem. Young people struggle and don't have the best impulse control. But the problem is, yelling or punching or, whatever that used to happen on the school grounds, is very different than guns and knives. And that's the other piece. And you said something that's really poignant, which is like they don't understand the finality of it, the reality of it. And people have been sort of inured to the idea of gun violence being this final thing. And the other piece of this, of course, is there's no funding for prevention or trauma care. People are going to be cut off Medicaid. So, this is something I know our governor and folks are really working on, but it may end up being really a grassroots effort. Parents and community members, with the guidance of the leaders who have access to the kids and can work with them on a day-to-day basis, we need to come together. We can't rely on the federal government or even the state government to do this, even though we would love to have prevention dollars and more trauma money, but I'm not sure that that's in the near future. But it is a call to action, and I think the community board is, I applaud you for raising this issue, and I support you in trying to, get volunteers and mentors and advocates to really commit to an ongoing safety initiative, because we can't take this sitting down. We have to come together and say, you know what, we need to stop this violence. Our children are being killed. And this is very, very, very important and serious and wrong. There are some crisis resources, but that doesn't change what happens out there on the street. But just for your knowledge, there is a text line. You can text HOME to 741-741, or 988 is also a resource. And it's a federal crisis lifeline, which will provide people access to services. But I see the solution more as an education piece where we all have to join together to take this back and to protect our children.
Could I ask a question?
Absolutely.
In terms of the staff,
Whoops,
in
sorry.
the schools in general, there are guidance counselors. Do they approach any of the children that have problems? Or is that more of a clerical position?
So this is my experience over the years, and I don't want to speak for the schools now, but I will say that one of the roles that we did play is advising the guidance counselors because they are quite overwhelmed with they get all the kids who are the problem kids, and they're not necessarily trained clinicians. They're there really to support and guide the teachers and the kids. So I think they need a lot of support. And what we found is when we did consulting in the schools, it was less one-on-one with the kids and more our educating and supporting the teachers and the guidance counselors and the parents. And when you provide that as a resource and scaffolding for them, I think they are able to be more effective in their roles because the schools are being asked to do a lot. And unfortunately, in the public schools, we have to teach to the test, and they have to, pass regents and do all these things. And so some of these social aspects of school are not as they don't have the time or they don't have the expertise. But I wouldn't say that the guidance counselors aren't dealing with it because I think they are every day. I think they need our support. And the challenge is that the mental health field and the nursing field really was hit hard post pandemic because there was a high level of burnout, and what we saw and what we lived through, the death and the fear and all of that took a toll on the workforce. And one of the things I'm trying to do is develop in our new space a learning center so we can really mentor new people who are coming into the field. But we could also look at providing psychological or psychosocial education to the community. And maybe this is something that we could do in collaboration with the community board and offer monthly or biweekly, opportunities for Q&A and or brainstorming about some of the things that we can do. We have some amazing community members who are willing to do things. I don't know if you guys know about the friendly fridge, but some friends, colleagues that I know who during these really challenging times got out there and created a situation where there's people can go and get food for free and it's no questions asked. So I do think that there are people in our community who are willing and wanting to help, and now is the time for us to try to engage them.
Is it a good idea to uh, start in one school and try to build it up into that kind of thing? Otherwise, there's such a spread of devastation, it's mind-boggling.
Well, yeah, I mean, JFK is the obvious place to start, right? It's the largest school in the city, I believe, and there's different campuses.
Well, it's broken up into 8 schools. So
Right.
they're not,
So
that, if JFK is no longer.
Right. So, but that campus is really the place to start, right? There's a lot of different things going on there. I think before we get right into the schools, we have to have enough. We don't have the bandwidth right now at Mosaic to say, yes, we'll take that on. We need some community support around this, and we can certainly let the schools know what we could offer, and I think that now with the ability to Zoom and provide services basically remotely, we would be more successful in launching something like that. I think I've had a really hard time getting people to go, social workers to go and work in the schools. And so, but I do think that if we target, the other option is we hold off on that campus and we start with 141. And I know that principal, and we've done work there before. And maybe we create a model that then can be implemented in some of the other schools.
But I know her also, and I could speak to her.
Mhm.
Are there any other questions?
Yeah, I think schools are doing a lot. Well, I recently retired. I guess I'm getting out of that recently retired piece. But I know in the schools that I've worked in, budget is always a problem. It's not like they're not willing to get people in, but it costs money. And then obviously you want to try and embed something within the school day because especially for high school kids, once school is over, they're out. Trying to keep them in school for anything is a challenge. So it's something that has to be embedded. And I know in my school we've tried to embed social and emotional work, and we do it on that, what is it, tier one, tier two, whatever it is, on a level, a whole school level. But one of the challenges is the children who have much more need, and a need that the school or volunteers are not going to be able to work with, and them getting access to some more expert care. And where does that money come from to do that? I want to know if parents see their child struggling and decide they want a referral to get more sort of expert counseling. How is that done, especially if you don't have insurance? Are there free ones? I know there are some mobile crisis centers, but some kids need really long-term help
I was going to FaceTime 5 minutes when I came. Okay.
Yeah.
that is
So
not readily accessible. And do you provide that kind of service? And how much would it cost parents if a parent says, okay, my child is struggling, I really want them to get help, I
Sure.
can just about manage to get them into an office? How does that work?
Sure. Thank you for your question. This is the challenge, right? We do see children, we do have a sliding scale fee. We take all insurance. And we can see folks. I am having a tough time hiring people. We are expanding. We have a wait list right now, but we are hoping and really trying to grow our capacity because the need is there. And I think that one of the things that we have to be creative about is that the kids who really need this most are not going to volunteer to get the help. They are challenging their parents a lot. And I think what we need to think about is first, how do you identify those kids? And what ways can we engage them without, forcing them to come because they're not volunteering to come and get the help. And then when they do, the services are limited. So I've been saying this to everybody. Nobody wants to hear it. Everyone tells me stop talking about COVID, but the reality is we are in a mental health crisis in this country, and we're all feeling it. We all have anxiety. We all have, varying levels of stress, and the kids are feeling it tenfold. And when you throw an inability to problem solve and guns, it's a recipe for disaster. So this is something that we are trying to build. We're trying to rebuild it. And we used to serve over 1,000 patients. Post-pandemic, we were up to about 550, and most of the ones we lost were children. And we're building that back. We're up to like 665, but it's going to take us a little while. But the devastating part is, even as a parent, if you get your child to agree to get help, the services are not available. And it's devastating. And we have been trying to get more funding so we can attract more people. but we're working on it, and you can certainly refer anyone to us. We will do our very best to have them seen. We are developing groups as well, but I think it's going to be a multi-pronged approach. Because I know and I don't want to be critical of the schools. I think the schools are trying their very hardest. And I know parents are as well. It's a scary time. And I think what we have to do is, rather than say, oh, is there a, can we do this? It's really about building it. This agency that I run was built in 1959, and it was a response to the teenage drug problem that was beginning in the before the 60s. And our very first service was a hotline for teens. And I've actually met adults who said, I was one of those teenagers who called your hotline in the 60s. I think we have to think out of the box. Kids are very involved in social media. There's so doing what we did in the old days, which is getting up and lecturing to them in a hall or trying, in a bit, it doesn't work. We need to meet them in their space, and their space is virtual. And so I think what we really need to do is engage some of the kids who aren't involved in the violence to teach us, the adults, how to reach these young people. And because I think that there's a way to do it, but it's going to take some work. But you can give anyone our information. We have a website; they can call us, and we will do our very best to see them as soon as we can. Laura, you had your hand up?
Yes, thank you. I'm vice chair of the Public Safety Committee of Community Board 8, and I can't agree with you more. Everything that you've said tonight. We also at Public Safety very concerned about youth violence, and at our March meeting, we invited Bronx District Attorney Darcel Clark, and she sent many representatives, and they presented their concerns and some of their outlook as to why gun violence has risen so much in the Bronx with our youth. And they've one of the things we learned many things. We learned that there's billions of dollars that's been appropriated by New York State for implementation of the Raise the Age law, and this New York City is not eligible for those funds. So at our April meeting, our committee there was consensus that, you mentioned call to action. So we're doing a letter to our elected officials as to, especially in the Bronx, how we need this monies for services and prevention for all this gun violence. And so that's one thing about the funding appropriation. And that's a state policy, which we never knew.
Wow.
District Attorney Darcel Clark is a staunch advocate and proponent of Raise the Age law, which thankfully prohibits youthful offenders from being jailed with adults and many other things where they're steered to family court. So she went through the system with us of the goals, and yet within the system and the current laws, she sees loopholes and need for tweaks that she feels will cut down on recidivism and will, older kids, when you say, how are they getting the guns? How are they getting the guns? Older kids, gangs, they're giving them the guns because there's perception that nothing will happen if, you're youthful and you have a gun.
Yeah.
And, so a lot of that, because of how the system is working, crime is down due to Raise the Age for all categories, felonies and et cetera, crime, except for gun violence. More youth are carrying and using guns. So she, explained to us where, and we're working through this as a committee to try to do that call to action and try to understand it. They came to us after the murder at 238th Street. And I just want to say that we are very concerned and we take this call to action very seriously, and your work in the schools and your goals. And, we need to, the Public Safety Committee has the access, the police are there at our meetings, et cetera, et cetera. And so that's what I wanted to say to you. I know they've shared that they are now at school time, they are putting a lot of forces to prevent violence after school and along school routes. And, and that has helped a lot. They instituted that kind of system starting just in 2025 in September, where they noted, when and where, but they can't be everywhere. But anyway, this topic, that's why I said I'll have to tune in to the Education Committee and, because I really do see tie-ins with
Yes.
our concerns at public safety. So thank you for presenting this wonderful.
Absolutely, absolutely. And please let me know how we can be helpful. And I think this is a good start to something that is really important. And Mosaic will participate in the ways that we can. And let me know how I can be helpful, in moving this forward.
Definitely.
Well,
Okay.
I have a
Yeah.
question.
Yeah.
Can I ask a question? Hi. I walked in a little late, so forgive me if you've already covered this, but I was wondering if you offer parent workshops, something that I have wondered about now. I think having, I have teenage children down to like, I guess 12, but like in that age group. And one of the questions that we've sort of asked other parents is, do you have alcohol out? Do you have things out in the house, right? Like
Right.
you don't want your kids around alcohol. And I've actually started to have my kids ask, or I'll ask other parents, do you have a gun in the house, right? Which I know sounds like a weird
So-
question to ask that question, but I'm wondering if you're doing any sort of parent education to ask those sorts of questions.
Sure.
So we live. Sorry, I laugh. I am my husband's military, so we live. Now we live here. Now he's in the reserves, but we lived in other places throughout the country, not just New York. So I lived in Minneapolis and I lived in Birmingham, and we used to ask that question in Birmingham, Alabama, before my kids would go on play dates, and people's reaction was like ridiculous because everybody had guns in their homes,
Right, but
and it was just like
No, I totally I
Yeah.
get that, but there's a difference between having a gun in your
Yeah.
house and having your gun properly stored in your house, right?
Yes.
And I think educating parents, I don't know that parents always think about that.
Right.
I think that parents don't always think about how guns and ammunition are stored, right? We send
Yeah.
our kids to people's homes for play dates or
Right.
for, as they become teenagers, they're in high school and they're venturing out on their own. Like really helping parents help their kids develop that language around that, I think would be really helpful. And to have people be aware of that in the same way that you would want to know if your child is being driven around by somebody who doesn't enforce the seatbelts in the car,
Yeah.
or maybe texting and driving, right? It's all those sort of safety things that you would want to think of as a parent. And I wondered if that's something you thought about before.
Yeah, one of the things that we're developing, and I will, when we get that up and running again, we will let you know. But developing a program where we will have parenting groups, and we will give the community the opportunity to let us know what kinds of things they would like to come and hear about. And also, I think very importantly, we're developing or redeveloping something called the Family Support Center. where parents can come with their children, and we have groups for the kids and groups for the parents. And it's a wonderful, it's a multiple group modality that was developed and researched at Mount Sinai, and then we were one of the pilot programs, and it's highly effective and a great way for parents to utilize one another as resources with the guidance of a clinical person. Um, and the kids, it was phenomenal. They come and we feed you all, and then the parents go off and they have their group, and then the kids, depending on what ages they are in groups with their contemporaries. So again, we're rebuilding that. We had to close it during the pandemic, and it's been hard to get that back going. But in our new space, we intend to bring that back. So I will make sure that the community board knows about all the services that we provide. But if you go on our website, it's mosaicmh.org. You'll see some of the programs that we have, and there's a lot of good work being done, and we want to continue. We're very excited because we now own this new building. We were renting for many years, and so we now have a permanent home in Riverdale and are going to continue to serve the larger community with both psychoeducation and clinical services.
I guess it's more of a comment than a question. I know that and it's something that I think schools struggle with, parents might struggle with, communities struggle with, is that some kids are not, they're adjacent to this kind of behavior,
Yeah,
and they struggle with sort of extricating themselves away from that, and they can get sucked into it. They're not necessarily, actively involved, but they're adjacent to it, and they have to protect themselves, and they have to be safe. And one way of being safe is making sure you don't upset none of those people over there.
right,
So
right.
it's always a struggle. I can see, I used to teach kids who struggled with that kind of dynamic, or people in their family as well,
Yes.
who are involved. So they're, related to all
Yes.
of this.
Well,
And it's trying to, get the trust and build the trust with those students so they can feel comfortable dealing with some of that and not getting drawn into that side of life. You know
right.
what I mean?
And one of the ways to do that is to engage those children around things that they can do as alternatives. And part of that is really starting to understand what some of these kids are interested in, and creating a pathway for them to make a different choice, right? We all remember being teenagers and being offered to do things that we knew were not going to be good for us. And some of us said yes, and some of us said no. And there was points in time where things started to get more, on the negative side, really depending on the individual, whether or not they were pushed in that direction. And I think there are a lot of people where they get pulled along and don't really want to be, are actually really not happy in that situation, but are terrified to say no. And so I think one of the things that we have to think about is what other things are these young people engaging with that is stuff that they can be doing after school that doesn't involve this kind of thing. And I think, we have to be creative. Young people like to make graffiti and art, and and do dance and do these different kinds of things. And the challenge is that we really need youth leaders who understand what young people are finding interesting and engaging and meaningful, and then giving them those spaces so that they can make a choice and have the choice still be something they're interested in and feel a part of. Yeah.
Laura, did you have another question?
I think her hand is up, but I think she's
Yeah,
shut it off.
but I couldn't tell if it was up and then not down or what the story was. Okay.
Well, I guess we're done with this. I think this is an ongoing
going forever.
conversation,
It's
and
Notes.
I'm happy to do that. Because I do feel very strongly that it's an important
Mhm.
direction to
Yes.
go in.
Yes, this isn't a
And,
one-off. It's a beginning of a conversation that we should have about how, as a community and as a mental health provider, we can help take the lead in doing that. And I will get some of my other staff involved, and we'll begin to think about what type of, you know, offerings we can make to the community and to parents. And it may be that we just start with a support group for parents, and then move from there into the community to see what we can do to really lean in and help these young people and keep our kids safe.
Let me
Thank you
ask you, oh,
for
sorry.
inviting
Oh,
me.
Can I ask one more quick question?
Sure.
Have you done like a survey? Have you sent out a survey to people to ask what people want, just in general? Is that something you've done with your mailing list or with schools or principals that you've worked with, just to have an idea? How do you gather your data?
We haven't done that lately because I'm in the middle of moving an entire organization after 50 years from a building and integrating our services. But in general, we welcome everyone's input. We haven't done a survey around that of late. When we talk to our elected officials, they get a lot of feedback from the community about what they want and need, and I'm in regular communication with them. Um, and, I know we used to be very involved in the community board, not as much of late, but I think this is also a really appropriate and important space to do that. And we've held over time various events. We did one a while back at the Y. We've done a lot of stuff at the neighborhood house. We've worked with Riverdale Senior Services. And so we hear from the community through the other community social service agencies as well. But that might be something that we think about doing, in terms of finding out I mean, the need is great. I mean, like I said, we have a waiting list, and what we don't have funding right now to go out and be out on the streets and doing the kind of work. And we do have somebody who does geriatric work in the community centers and screens elderly folks for depression and anxiety and so forth. But there's a lot more that can be done. And if there's any way to get some of that public safety funding to fund some, psychoeducation, I think it would go a very long way.
I plan to hook up with the Public Safety Committee and the Youth Committee, and I think that we will come up with something when we all get together
Okay.
and throw this around. As you say, it's not something that you can just fix tomorrow.
Right.
It's a long range thing, so them being on the community board, I think it's appropriate that I get in touch with them,
Mm-hmm.
start a
Okay.
conversation with the other
Right.
committees.
Yep. Thank you all so
Well,
much.
Thank you for taking the time.
Mm-hmm.
It's
You're welcome.
very enlightening. And good luck with your new space.
Thank you. Thank you. And you know what?
Let us know
When we're all
when
settled
you're ready.
in, maybe we'll host a community board meeting over there and you can all see what we do and get a sense, because the more people that know that we are going to be there and providing the services, the better. And so we would welcome that very much. And we reach out to me again and we will keep the conversation going.
Yes, I
Okay.
plan. to
Thank
do
you so
that.
much. Have a good rest of the meeting.
Okay, thank you.
Care. Bye-bye.
Bye. Uh, the next, where's my system? Here. Classical charter school.
Good evening. Good evening, everyone. And I will not be long for just the interest of time. I do have to go to another appointment. And so thank you so much, for allowing me to have the opportunity to address the board. I just want you to know about classical charter schools, that there is a school that will be opening up on 3880 Sedgwick Avenue. And we're looking just really for partnership and introduction, for the community board to know who we are. Classical Charter Schools is a K-8 school that prepares students to excel in college preparatory high schools through a classical curriculum. They provide a highly structured environment. The school has been in existence now for 20 years. I am the founding dean of students. I am now in charge of family and community engagement, which is highly just enlightening to know that there are resources out there. And as the speaker before had mentioned, that the concern for youth violence and all of the concerns about what is going on in our community is certainly something that needs to be addressed. But I do feel that through Classical Charter Schools program, we do involve students in what we call community circles through character education and character development. There is emphasis on parent engagement, but we do realize that's just one aspect. And so it is very important for the community, number one, to acknowledge that it needs its healing, and recognize the resources that are already present. I think that there are parents, as you've already mentioned, that are stretched. And I do believe Classical Charter School offers that opportunity for families that are seeing a struggle, not just in the home, but also academically. We have 5 national blue ribbons, and we do pride ourselves on emphasizing a program that's not only rigorous, but really stretching to support children who need IEPs, who need 504 accommodations, and other services. We do provide the small group instruction, but more importantly, I think it's looking just beyond the academics and realizing children that go to our school live in the community. And as it was mentioned, that while children, and at least at classical, will be given an opportunity for a strong, rigorous academic learning program, we still are faced with the issue of mental health and mental illness and the drug epidemic. And so these things are very apparent in the lives of our parents. Although we try to address them, we cannot dismiss or act as if they're not prevalent. And so as such, I think it's important not just to have the connections at Classical Charter School in the community, but it's also making sure that we're building a real partnership, and so that we're identifying programs that are really doing the work and looking at creating a strong sense of community so that we can address these bigger issues as a community. And so I want to again introduce Classical Charter School to this community, but also let you know that we're very open to be a part of the community and to do whatever is necessary to bring healing in the community.
You say that you've been in that location for 20 years?
We have been in existence for 20 years. We have 5 campuses. The location at Sedgwick Avenue will be it'll be School 5. And so right now we have 4 schools active. The 5th school will be on Sedgwick Avenue.
So this new one is in Manhattan.
I'm sorry.
on Seventh Avenue.
No.
The new location is on Seventh Avenue. Is that in Manhattan?
No,
Cent-
that is,
Cent-
it's in Kingsbridge.
The Bronx?
In the Bronx, in
Yeah, the
in-
Bronx.
Yeah.
I
but-
see.
And one other a thing to note is that at third grade, students are introduced to Latin and debate. By the time that they're in eighth grade, they have an opportunity to go to Italy. And so our students do graduate and go to some of New York's best high schools, Bronx Science, Brooklyn Tech, Bard. So some of the better schools, but we also recognize, again, we have families that are vulnerable to some of the violence that's in the community, not just in this community where our school 5 will be housed, but in others where our other campuses are located.
I have a question.
Sure.
One of the issues, I'm sorry, one of the issues that has come up with charter schools is provision for children with special educational needs and their services. And if
Yes.
they don't fit in with the program, that they are exited from the schools.
Mm.
So where does Classical stand when it comes to children with special needs, and how do you get their services? Because I do understand that in some schools, accessing the services that they're mandated to have can be problematic.
Yeah, so that is a case for some schools, but it's not a case for classical charter schools. So we have a student services team that addresses and supports students who have IEPs. We do have small group instructions, and before they even get into the IEP process, there's a lot of at-risk supports that are given to students so that they can make those benchmarks and get on grade level, whether it's in reading or math. So we do not look at those as scholars that struggle in certain areas as students that we just want to push away or push out. But that's just not what our school is about. We do try to support students who have multiple learning challenges, and even students who have autism.
Okay. Do you do 12 to 1-to-1, or is it just ICT that you're restricted to?
We do the ICT. We don't do the
Anything else?
small group instruction because of the capacity is a lot of it. So for us, we may not have the capacity within our setting, but we do try our best to meet those needs and with the resources we have.
Okay.
All right. So again,
Okay, thank you for
thank you
coming
so
and
much.
introduce yourself. How many children do you have in Cedric Avenue?
Well, right now it's we're just opening up, so it'll be K to first grade, and so each year we will add a grade. So right now we have about 120. We're still actively enrolling to get more, but it will be small starting out.
Is it a freestanding building, or is it in a building and just space rented?
Space is rented. We are working on building our own building, and that probably will happen in 2027. But for now, we're just using this space so we can get started.
I see. Okay, well, welcome to the community.
Yes, thank you. And thank you for having me, and I look forward to working with you. Have a good night.
Okay,
All right, good night.
right,
Good night.
thank you. Tatiana.
Good
you're
evening,
on.
and thank you for the opportunity to speak. My name is Tatiana, and my work at CUNY School of Public Health focuses on nutrition and food policy. I'm here today to support Introduction 80-2026, which would require the Department of Education to report on how nutrition education is provided across New York City schools. From what I've been seeing, nutrition education is not consistent across schools. Some offer complete programs, including cooking classes and gardening classes, while others offer little to no instruction, and there is no clear way to understand how it's being delivered at the school level. Without this information, it's hard to see where the gaps are and how to direct resources. This is especially important right now, as we're seeing rising rates of obesity and other diet-related conditions in a food environment that makes unhealthy options easier to access. Schools play an important role in shaping student habits. This is exactly why this bill aims to address, by creating that visibility and making it possible to identify where more attention is needed. As this community board represents part of council members' district, your perspective can be especially valuable in helping move this conversation forward. I actually recently had the opportunity to speak with council member Dana White's office, and it's clearly something that's getting their attention right now. So I encourage the board to support this bill, including considering a letter of support to the city council. Thank you. And I'm also happy to share a brief summary about this bill, if helpful.
Whose bill is
I
this?
looked at the legislation and I saw the summary, but I'm not quite sure what is going to happen with the legislation.
Sure.
Who is going to do the nutrition and
Yeah, that's exactly what this
whatever it's
bill
called for?
aims to do. It aims to actually, it's more a reporting obligation. So it will build on existing activities of reporting how nutrition education is currently delivered, but it would require more specific information, such as who are providing those kind of information, and the number of certified dietitian teaching in each school. This is important to guide future legislation about nutrition education. So it's more than a reporting obligation for schools. Because right now we do not have visibility. Right now we do not have visibility on how is this provided across schools. As I said, some schools are offering gardening classes, and others no education at all. That's why this bill is important.
In 2024, somebody came from CUNY and spoke on this message also. The legislation was introduced at that time. We did not approve of it because we didn't understand it. And after looking at your piece, I personally still don't understand it. I sent it to everyone in the summary paper. Are there any questions from the group?
I mean, could it be linked to, is there any link to what they feed students in the school? Because that's not healthy. So, I mean, I know you want to report on whether they're educating kids, but is there anything in the legislation that will speak to what is served to kids in schools?
Not in this particular legislation, no. It's more about nutrition education, because it's really important for schools to provide it. It's where children get their basis education for everything. So nutrition is very important, especially right now with like this food environment where we see a lot of unhealthy options for kids. So having this kind of education, for example, there are schools that are educating on how reading nutrition labels. So this is really important for kids to understand, to differ something like ultra processed food from a healthier option.
Mayor Adams was also very interested in getting healthy food into the schools, and that all ended up in the garbage because the children wouldn't eat it. What makes you think that if you give them healthy food, that they're going to be happy with it?
Yeah, that's what about you're talking about nutrition education. For example, if kids have access to garden, their kids are naturally interested in learning about nature, where food come from. But in today's environment, that's not possible. And with this kind of education at school, at the school level, they would have access to it. That's
Can I ask?
that's the main point
can I-
about this legislation.
And what grade would this be in?
I'm
If
sorry.
it becomes?
Um,
What age group are you using as a measure?
Or you're considering school children, all ages.
So early, like elementary school age, high school?
Yeah, school
Okay.
age children in general.
Uh-huh. Okay, I have another question. It's all well and good to educate students on what they're looking at, let's say, on labels or what's, I don't know, labels, I guess, or on a garden, picking their own vegetables. I understand the value in that, but just like my fellow board members brought up, what's being served to them is very important. And I wonder if part of this bill also educates parents because they're the people who are buying the food. So, and it always seems to be that like, if you're going for less expensive options, they tend to not necessarily be the healthiest also. So parents are making decisions based off of different socioeconomic reasoning and other things. So are you educating the parents? What are you doing to help the parents? Because if you're educating a third grader who doesn't have the resources to be able to go and do this themselves, it's not really beneficial. And as my board, fellow board members said, if you're not like feeding them the right things at school and then their parents aren't getting the right things, they don't really understand the point. I'm a little confused.
No, yeah, of course. I totally understand your points. So what you're doing with this bill, it's not creating an obligation to on specific nutrition education. It's more about understanding how it's currently being delivered so that we can then provide more specific legislation on with instruction schools how to perform it. It's right now it's more kind of understanding what's happening because we do not have this visibility with the data we currently have.
It feels backwards. It feels like you should be supplying them with the healthy food and then educating them,
Right.
not educating them.
Yeah, of course,
and
but
then-
I think those are different topics. It is not about what is being discussed with this bill specifically. So this bill's it's more about the importance of nutrition education. And I totally understand your point. I think that what's being served is of course important, but for children to understand their options, they need to have this kind of nutrition education. That's my point. It's something like before that. And it's not creating obligation for their parents because it's on the school level. So
Yeah, but the
for
thing is that
and it would
kids
be
don't
like
have
age
options.
appropriate.
Okay, it just to me, I understand what you're saying. I'm a teacher. I've worked in multiple different grades. I understand what you're saying as far as educating people. It's just confusing to me when the target audience that you're looking at is school age kids, which by the way feels a little broad, right? Like are you talking about first grade? You're talking about 12th grade? Like I'm a little confused about what you're talking about. But school age kids, right? Many of that bracket are not in a position to make a decision on their own. Maybe they have pocket change and they're going to like a bodega on the way home and they can pick between chips and chips because they can't buy nuts. That's going to be really expensive or some other thing. So they're not going to like, I'm just confused. I'm just sorry.
No, I see your point, but the thing is more about the importance of nutrition education and I mean, with the not, this should be like standard in every school for children to understand what they're eating, what's the purpose of what they are eating. So of course, as I said, it will be like age appropriate. So if you have children like elementary schools, for example, they would need to have education appropriate for this kind of age. So having access, understanding food, touching food, for them to create like this interest in healthy food, and not like getting a
Right.
package because it looks like there's an image they
I
are
I
familiar
don't
to.
understand. If you have a garden, like the school that I work at has a garden, and they grow vegetables, and they grow fruit, like low fruit, right? That's not enough to feed the school. So like people have to, you learn where it's from, but then you have to have parents or a school that's serving that food. If not,
Right.
like, I mean.
Yes, of course. I'm not saying that this bill will solve our problems, but it should start at some point.
Uh-huh.
We're seeing like rising rates of obesity and diet-related conditions. So what we're doing to solve this kind of thing?
Well,
I think it's like a
that- I
multi
think-
effort. So this bill would be a part of this effort.
I don't agree. I don't agree. I think that like what's confusing to me is that it's one thing to educate somebody, right? You could read about doing something or learn about doing something, but if you don't have the resources or the abilities to actually pull it off or to really have an actionable way of executing it, I don't understand it.
No, so this bill.
I would feel more comfortable if this was part of like a series, right? This was the beginning, and then there was more to it, but this just feels confusing.
No, but that's at the beginning. With this information, we will understand where the resources are most needed so that we can direct these resources.
What does that mean? What resources?
resources?
What resources?
Well,
Better
public-
food for school?
Public resources for schools.
But I think we know
We
that
know that
school
already.
lunches are terrible. They're not nutritious.
Yeah, we know that.
And the parents need education, and we need funding to be able to help parents get healthier food.
Like not living in a food desert.
But
We
we
can
should
do
start
that.
at some point. We should start
Food.
at some point. We cannot just all leave our children to like
City run.
eat whatever that is in front of them without understanding the consequences of it.
So then the children should skip the meals that are being served to them in school? Like
No, of
that's
course
the-
not. But then this
Okay.
would be like start. They understand what is healthier. Then they could choose the healthier option between the ones that are being served.
And where they getting it from?
Maybe, okay.
Yeah, I don't know.
I hear you, and I need to think about it.
Okay. Well, as I said, I'll be happy to share with you a summary about this bill or to answer any questions you may have. But thank you again for the opportunity to speak here.
But, I think I get the idea and I feel the same way that I can't support that legislation. So we can't, support it.
Okay, well, that's unfortunate.
But good-
As I said,
and
I have
later,
already discussed with Chair
To
Dunowitz
turn it
office.
around and make it plausible for the
We're willing
children to know what was going on
vote
so that they
on-
could
to
participate
override the mayor's
and be
veto.
part of the.
I'm really sorry, there are two
development of the
people
house.
speaking and I can
That
hear
would
you.
be something better.
I was just being said. I'll listen.
I'm sorry, I couldn't hear you. There was someone else speaking at the same time.
Well, I basically, I'm not going to repeat what I just said because it's not, important. The important thing is that, we have questions and, I feel that, I don't know, Emily, are you for this?
Oh, no, I'm anti it. I think there's more important things to worry about in the world.
Okay, so,
I think
Georgia,
the city
you
council
have
should go
something
vote
to
on
say?
other things.
Yeah.
Yeah, don't
No,
worry about
I
this.
would not agree with that either.
Okay, so it's unanimous that we.
I think
can't support
Councilmember
it,
Brewer
but
should
thank
go
you
work
for
on
coming.
something else.
Yeah, there's more
Yeah.
important things to deal with.
Should go work on something else.
Okay, thank you. Thank you for your time.
Thanks
Have
for
a good
coming.
night.
Thanks for waiting.
Okay. I felt that way in 2024.
Thank you.
It hasn't changed.
It's being recorded.
They took the bill and they put a different.
I
number
just
on it.
like,
They've got so many other
The
things
truth
to be
is- the
worried
truth
about.
I literally, that is how I
It's
feel.
actually, to be
So
honest
many
with you,
other
it's a
things.
good idea. It's just not step one.
No.
It's like step 3 or 4.
Yeah,
Right.
So we need that beforehand.
Yeah.
Right,
There's so
and
many
it's
other
like
things.
information, like you're just giving,
And-
right, like you're
It's not
just, you're not,
actionable.
right,
There's
that's,
nothing
that,
actionable
you,
about
right,
it.
you took the words, right, you said it way better than I did, like, you're not doing anything. You're just, you're not doing anything,
doing
you're
it on
just giving
paper. You're
information.
doing a report.
Thank you.
You
Thank
know,
you.
what is that gonna be good?
Okay,
for?
hold on. Let's see who has.
Sorry.
Sorry. Okay, Laura, yes, I'd say.
Cause the full schools in District 3.
That may be from
No.
before. Okay.
Okay, the only
Is
other
that-
thing,
And do we have libraries?
So libraries?
Librarians are here.
okay. Yeah, we have two librarians here. Oh, three.
Right.
If you'll just wait a moment, I have to pass. What happened was, I had my January meeting and on the minutes, it was put on all of the dates for the rest of the year. They put on May 26th. And just recently, I was told it's a holiday. By that time, all of the slots were filled,
May
so I can't have a meeting in May at all.
No, it
So,
isn't. May 26th is
I have to
is
pass my
Memorial.
budget today.
No, it's Tuesday.
No,
And-
May 26th is a Tuesday. It's not a.
What?
It's not a, May 26th is a Tuesday.
I'm gonna
Yes,
tell you.
it's a Tuesday,
But
and
it's-
they start to celebrate the night of,
Oh, okay.
and the
okay.
27th is a
It's
holiday.
Oh,
Eid.
is it?
And
Oh,
Eid.
Eid, yeah, right.
Ramadan.
Yeah. So, I was squeezed out.
And the dates.
They gave me the 5th,
Beautiful.
and that was too soon after this one.
Mm.
And in the meantime, they gave that away too, because I said it was too soon. So they shut me out altogether in May.
I'm so bad.
June, I don't have a meeting because the schools are closed by the time the last Tuesday comes around. And that's why I have such a long agenda tonight. So if the librarians would just hold out for a few more minutes, I'll get to you, I promise.
No, it's not awful.
But we have to give our attention to the budget. I wish that Daniel had stayed, but did everybody look at them? Last meeting, I had sent out the schools that responded to my letter. And they were very cumbersome, and I've kind of simplified them. And does everybody have a copy?
Mm-hmm.
Do you have one, Emily?
I do, I have it pulled up.
Okay, so are there any questions on it? If you go down them and the reason that I put 95 up on top is because they have been trying to get some money from me for years, and they stopped asking, and now, of course, they decided to join us again. So I felt that they should get the attention. The charter schools have never been
Don't they have extra
included.
funding? I'm just wondering, don't charter schools just get extra funding anyway? I'm surprised that they're
Well,
asking for stuff.
The chair of the community board insisted that I have the charter schools.
Oh, God.
I have never had them before.
No, because they have money.
So I have interspersed them in rotation. And that's why they're
Just taking it.
in there. I can't really throw them
Yeah,
out because
no.
then she will go crazy.
Yeah, it's just that, you know, the idea that, well, I guess that's how it goes. I just
And
feel
they-
that
they make their own
schools-
money.
Yeah, they get money, they have a lot of money.
Yeah,
And our other schools,
and I
no,
argued that point,
budgets are tight. So I'm
Yeah.
just like, how are they
but
coming with their hand out? But anyway.
there's nothing I can do.
No,
about it.
yeah, I understand.
But the 95 that I didn't even know the United Charter High School. I've never been there. But they did submit 141. That is something they wanted. Atmosphere, something they wanted. I mean, I gave them what they wanted. I did not give them everything that they asked for because they were told to pick one capital project and one expense, and some of them gave me 49,000. You know, they figured if they're gonna ask, they're gonna ask for a lot of things. So I had to whittle it down. But do you see any negative things? Something that we should take out?
No.
Actually, she didn't put it down the expense.
It's on the back.
You have the expense?
It's on the back.
Yeah, that's, oh, and it's on the back. Oh. Uh-huh. That's less than $30,000, the expense, and the capital is more than 30,000.
Mm-hmm. So are we ranking them? Do you want to rank them?
I take a consensus of approval.
I mean, I think that the list looks okay.
It's fine.
But do you want to rank them? Is that what you want to do now?
What?
Do you want to rank them?
Rank them?
Or do you want to
No,
just give them
I put it like this because of the situation.
Okay,
I want 95 to be able to get something after all the years that they've been
okay,
trying.
so the list, so the order that you put them in is the order that you would rank them.
Yeah,
Yes?
Yeah.
Okay. So are you putting, the New York City Public Libraries last?
I put that down. I'm not sure if it should be capital or expense. So that I'll leave up to the
Okay.
budget person to decipher which it is.
Cause I think that's really important.
Yeah, but that usually is accepted.
Okay, good. Okay,
The Kingsbridge Library was given the Sundays.
yeah, I remember.
So I figured that we might as well ask for the whole bunch.
I think we should. I think that it's being used.
Yeah.
I think that,
Okay.
That,
Well, it's
so
upgrades,
my
purchases,
order of this is not going to be the way it is on the actual finished budget.
Okay.
Because we have 13 committees and each one has a
Right, of
number of
course.
items. So they're going to move everything around.
Okay.
Okay, sounds good. I think
It's
it's,
just our list.
right, I think this looks good. What do you think?
I think the security system should be a priority.
Yeah, I think so, but it
Over-
sounds like they're moving.
They're gonna move, I mean, no, but if they look at this and say, oh, we think this is more important than that.
Yeah,
Oh.
that's why I was wondering if we should have put numbers on this.
That's what I'm thinking, because I think safety and security of a school,
But I'm also wondering
I don't
that
understand.
that may be a lot more expensive than some, I don't know, but what the likelihood of it
Yeah, I'm
being.
wondering about that actually, yeah, because they just recently.
So isn't that grants? Isn't that specific
Which,
grants?
which
like
are you
secur-
considering?
Security, when you look at upgrading
Capital
security
versus
system,
Which one?
the security
Versus
system at
yeah.
AIM Park Neighborhood School, like I would expect that that'd be quite expensive.
Right.
Or also the other question is there a specific grant that can be used for security? Cause I feel like there are a lot of grants for school
Right.
securities.
And didn't the
That's
city
it.
just update,
That's what I'm saying.
upgrade? Yeah,
That's what
they
I'm
just
saying.
did a
I
whole
don't-
security.
that's why I think it may be-
No, that's
They-
what
That's what I'm saying, I think
Uh,
it may be fine there. I
Yeah,
don't know.
yeah, because they just did a whole thing.
Yeah, I'll
They
tell
do
you
school
what they
these days.
want to.
You know what, I think
That was
So, Sylvia, I think
$450,000.
that's what I thought, but I think it's fine. I think it's
Yeah,
fine. the way-
Yeah.
I think,
because
I think.
they're not gonna do it anyway.
No,
No.
I think that this looks good, the way you have it,
Yeah,
in my opinion. I think we all feel good about it.
Yeah,
I think, Sylvia, I think we all feel good.
yeah, if I have it on the original, $450,000.
That's what I figured. I think we all feel good.
Yeah,
it's fine.
Thank you.
I try to keep within the prices.
Yeah.
Yeah, no, I heard it.
After the listing.
Yeah.
Okay, so, that's done. Now, libraries. Rebecca.
Hi, good evening.
Good evening.
I hope everyone's doing well. Can you hear me?
Yes.
Okay, beautiful. I will be very brief. Maria from the Durham Park had to leave early. She just wanted me to let you know that she has a lot of new programming, including some tech programming for the public and some classes. And she'll be forwarding that flyer to you tomorrow. But she was staying late for her EOSL class and she had to lock up her and secure her building. As far as Riverdale, we have a lot of things happening. I will also send you our calendar tomorrow, but most notably, during Bronx Week, all of the Bronx libraries celebrate and have special programs. Bronx Week is from May 4th to the 17th. At Riverdale, we're having community plant exchange is one of our highlights, which is on the 16th. It's a Saturday, and the whole community comes out. We have coffee, tea, some light refreshments, and a lot of community engagement happening on that day. It's just a very beautiful, nice, classy day at Riverdale. And then after that, at 2 o'clock, we will be having a flower arranging workshop. But like I said, we do like 30 programs per month, and we're doing our part with the youth. We're seeing all of SAR this week. PS 81 is going to be coming in. And yes, we do have a space for teens. So we have 3 weekly teen programs. So I noticed that you were saying that there needs to be a space for teens. Libraries have it. So, and they do come. All right.
Rebecca,
So
when you say that all of SAR is coming in this week, what does that
not,
mean?
well, not all of SAR. SAR
All
first
1,200 of you.
grade
I was just-
and kindergarten classes all this
No, it's
week.
just- Oh, okay, that's fair. No, because I actually had a couple of your librarians come in to speak to my middle school.
Yes. Jalissa,
Yeah, so I was. Yeah,
our
no, I
teen
know.
librarian. Yes.
Yeah, it was fabulous, but
We're
I
on that page challenge
oh yeah.
to see who can read the most
Yeah,
books, right?
yeah, that's right.
My daughter is carrying her class.
Okay, I have to, yeah, I should just say what Emily was just saying is I just launched a reading challenge in the middle school, and the 6th, 7th, and 8th
Okay.
grade need to read 500 books in the next few weeks.
Oh, I
collectively.
love that.
They have to read 500 books
They don't have
collectively,
that.
but
I've read 1,000.
if all the grades contribute, then all the grades get the prize, which is an ice cream truck, which is super exciting. But if only one grade really carries it, then they're the only one that gets it. So they're getting uber
Oh.
competitive about reading. It probably will it warms your heart. You watch these kids, they come into the middle school library and they're grabbing all these books and they're like, God, Miss Filer, what's the stat? What's the stat?
Well-
And I'm like giving you all the numbers of how their grades are doing. So it's pretty
That
exciting
is
stuff.
absolutely terrific. And if they have library cards, they can check out 50 books with each library
That's
card.
awesome. The most important thing is that
And
I
we're
get
here.
ice
We
cream.
have all the books.
My daughter's
So-
a major contributor to the ice
I'm
cream.
telling you, they're getting super competitive. It's awesome.
Basically, I starve her at home, so she really needs this ice cream drink to come.
Anything that we can do to support. I speak for myself and I guess all the other librarians. We love it. Our circulation at Riverdale was up 22% for
That's
the month
awesome.
of March. So that is all good and positive news
Ruthie
for our
Robinson
community.
carrying the books.
It's all about that ice cream. And the reading, of course, but the ice cream.
All right, so I'll hand it over to Aga or Biz. I think they're still here. There's Aga.
Biz, I can take Biz. Are you okay? Or
Yeah,
okay,
that's go ahead.
okay. I'll be very brief. Good evening, everyone. I know it's past bedtime for many of us. So, just quickly, Spite and Dival is doing great. We busy. Thank you for the support. Community comes every day, and we busy. We're busy. We doing our part, as Rebecca mentioned. I just want to highlight three programs, three new programs that are happening at the branch. One is a big community baby shower that we're throwing in at Seaton Park at the end of May. So all families with babies are invited. We're gonna have a big story time. Miss Melissa, our children's librarian, is organizing everything. There will be music, games, all aligned to the little ones. So if you know of any families with little kids, please, tell them that on May 30th, there will be a big baby shower in the park with New York Public Library. Then we also holding English as a second language conversations at the branch on Mondays at 4:30. Those are free conversations for anyone who would like to practice in a non-judgmental environment. So if you know of anybody who could use, practicing English at a very low-key, friendly environment, we holding those classes at the library. And then the last but not least, our newest addition to adult community, we have a read aloud program, which what we do is we go through Shakespeare's plays. Right now we're doing Macbeth, and all the participants are choosing character that they want to perform, and it's reading aloud, and they all enjoy it. So this is something new that we're trying this year. So if you know anybody who would like to try Shakespeare, you don't have to have any artistic background, any acting background. You just want to learn a little bit more about Shakespeare, then this is something for you. So this is it for Spite and Dival. Thank you so much.
Okay, thank you. Vesperat, are you there?
Hi, yes, I'm here. Can you hear me?
Yes.
Thank you. I will also be very brief in the interest of time. I do have similar programs to announce that's similar to Spandival. We just heard uh, three items. This coming Sunday at 2 p.m., we have improv for seniors. So there's no registration. Everyone is welcome to show up at 2 p.m. this coming Sunday. Improv for seniors. We have an ongoing program for 2 months. It's 8 sessions. April is wrapping up right now. On Thursdays, 11 to 12, we have bilingual story hour for children, bilingual in Spanish and English. It's a very fun, packed program, but please invite the community where children can sing along in Spanish and English. Um, and then the third one is starting next Wednesday, we have a new program called We Speak NYC, which is an initiative of the mayor's office in partnership with the library. We Speak NYC is an informal um, space for English learners to come and practice conversational English. So the class assumes that they are um, about high beginner level. So they have some, they have some, a skill level that they can communicate well enough, but they're not advanced. And it gives a chance for folks to come and in practice in person. So that's going to be for 8 weeks, May to June on Wednesdays. It's a 2-hour program. So please invite your community and anyone that can benefit from the program. It's called We Speak NYC. Thank you.
Okay, thank you. Did I miss anyone? What's it?
I think that's everybody.
Who's Abigail? Just,
I guess maybe somebody
Listening?
just listening in.
yeah, just a resident. Okay, well, thank you very much, everyone, for coming.
I think I ate a banana.
And we won't see each other in this room until September.
Oh my God, my goodness.
Okay.
Okay, well, have a good night.
Thank you. Good night.
Thank
you.
Right.
Bye.